Assalamu alaikum wa rahmatullah. I'm Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist working in Erbil, Iraq. And yesterday we presented this case of a 10-year-old male patient presented with left leg swelling, tenderness, fever, and generalized ill health. And we discussed the findings yesterday, and as we can today we will discuss it even more, and we will discuss the diagnosis. First of all, you can see these are T2 weighted fat saturated sagittal images of the leg, and you can see there's diffuse bone marrow edema seen involving the whole diametaphyseal region of the tibia and associated with marked surrounding soft tissue edema. The hyperintense signal are all parts of the diffuse edema. And you can see there are some linear hypointensities here and there within the tibia itself. So let's see another image, maybe this one. This is T2 weighted fat saturated images. Also, you can see the bone here is abnormal, diffusely abnormal, even crossing to the medial malleolus, and you can see some cortical destruction here on this part, and you can see some thing here, some hypointense signal, and obviously this is the periosteum elevated, and there is a fluid signal intensity deep to it. Again, on this T2 weighted non-fat saturated image, this is without fat suppression, you can see the serpiginous linear hypointensities within the tibia. And let's see the axial images. You can see evidence of a cortical breakthrough here. The cortex of the bone is broken, and of course there is a fluid signal intensity here indicating bone marrow edema with abscess formation. And when we give the patient contrast, you can obviously estimate or see the enhancement. This is the first. Let me show you the T1 without contrast. You can see it's all hypointense here. Okay, I'm just gonna show you even more. There is cortical breakthrough here, and you can see the abnormality or the hypointensity. This is a T1 weighted image extending from the within the medullary cavity to the subperiosteal region. And after contrast injection, you can easily appreciate the diffuse post-contrast enhancement all over, and even especially in this part. And this whole bone marrow is enhancing, and the subperiosteal collection is also showing post-contrast enhancement. So of course this is a typical case of osteomyelitis of the tibia with abscess formation. It's eroding the bone and it forming subperiosteal abscess, and I'm sure if we waited a few days, there will be a sinus tract opening into the skin of the patient. So the report for this case was as following. Marked diffuse bony marrow edema seen involving the distal half of the tibia with serpiginous linear hypointensity seen involving the tibial diametaphysis, with evidence of cortical break at the anterior aspect of the tibia about 5.5 centimeter proximal to the ankle joint, with extension to the surrounding soft tissues and small abscess formation at the anteromedial aspect of the leg measuring 9 mm in diameter. After contrast injection, marked diffuse heterogeneous post-contrast enhancement seen involving the bone marrow and the surrounding soft tissues. Findings are indicative of osteomyelitis with abscess formation, intact fibula, and there are no other remarkable findings. Thank you very much for listening, and see you with another case. Goodbye.